We are 2 years into the global COVID pandemic, and we see the effects in some countries start to level off, temporarily. While COVID cases in the US have been falling steadily since the winter surge of the Omicron variant, other countries have been experiencing heightened levels after lifting restrictions. Even within the US, different regions experience peaks at different times. For sponsors looking to conduct studies for COVID therapies, it can be tricky to predict which regions to initiate sites strategically. For example, suppose you only choose sites in the US Northeast and plan to open enrollment during the fall and winter. If your window of opportunity is narrow, you may face unexpected delays that push enrollment towards the spring and summer months, and suddenly, your trial is at risk. The most straightforward way to safeguard your COVID trials against this risk factor is to distribute your sites across regions or countries where COVID peaks and valleys are staggered. However, you must choose carefully if your resources are limited. As we all know, the more regions involved, the higher the cost. One of the best ways to make these difficult decisions is to analyze the now robust data set that charts COVID fluctuations across the globe. For example, earlier this year, COVID cases in the US fell to their valley, while COVID cases in South Korea surged to their highest peak since last fall. It would help to keep an eye out for other confounding factors, such as vaccination rates, emerging variants, and the cost of running clinical research in different regions that can influence your site selection decisions. P.S. If you're looking for help selecting study sites in the US or Asia, reach out to CliniBiz. We have access to various qualified investigators and study sites and leverage our automated site outreach and qualification process to identify, analyze, and recommend sites easily.